All right, day one. I just had my surgery and I look really beautiful. You know what? I'm really surprised. I do not feel that bad. I look like shit, but I don't feel that bad, so that's good. I was really nervous. But I don't know if it doesn't get worse. It's not that difficult. But everybody's different, so don't assume, oh, it's no big deal, let me just jump on an operating table. I did lots of research beforehand. I'm a little obsessed with the subject. And you should be if you're going to do this, because this is surgery, this is the real thing. This is not like I'm going in for Botox. This is like real. My doctor, Dr. Phillip Miller, is awesome. He's a, doctor on the Upper East Side. And if you live in New York City, that's where you want to go, because that's where all the rich people are. And the ones that have plastic surgery, pretty much. Between Park and Madison. Okay, so these avenues are very exclusive. Anyway, what am I feeling? Not really pain. I just took Vicodin. That's probably why. But before I took my first Vicodin, I was just feeling sore, a little sore in my jaw, like having gone to the dentist. And my teeth were also, my upper teeth, the gums and everything, they were a little numb. To be expected. But I'm doing pretty well, actually. My nose was a little blue. And I guess they said that I took to the epinephrine too really well. Epinephrine, I guess, constricts blood flow. And so my nose is blue at the end. So I had to put warm gauze soaked in warm water to keep the blood flow, like to try to bring the blood flow back so my nose doesn't fall off. I don't want that. It's not a good look. Okay. Yeah. Oh, but then it's kind of confusing because I have to put ice packs on here. I can't put it on my nose. I have to put it on like my cheeks. And then I have to have it warm on my nose. I was like, my face is going to catch pneumonia. I'm doing really well. I'm really surprised, happily surprised. My doctor's great. My anesthesiologist, amazing. Now it's just time for the results, like just got to sit and wait for the results. But yeah, I'll get back to you. I wanted to get back on here as soon as I could because I wanted to show you guys the actual what the experience is. I've seen a few of these other ones, and sometimes they're not back on right away, and I wanted you to see. I literally, it's 1:45 right now. I got out of surgery at like 9:30 a.m. So we're talking 4 hours. I'm very lucid. I think I'm lucid. I don't know. I'll watch this back later and I'll be like, oh. No. I'm very lucky. I was very nervous before, but I'm right now at this point at 1:40, no, 6 p.m. I'm happy with going through with it. So we'll see how the end result is. I may be like, oh my God, what did I do? But I don't think so. My doctor has got so many plaques and awards literally stating that he is one of the best doctors in America. You can Google him. I think, I know I saw a video of him on the Today Show being interviewed by Katie Couric, so you can probably find it. Dr. Phillip Miller. Like I said, I did a lot of research beforehand, and I used Dr. Palmer's book called What's Your Number? And it basically helps you determine, I think I'm bleeding, it helps you determine what you need, like what your face is missing, if you need surgery or whatever like that. You can do makeup, whatever like that, but it helps enhance your good features. And anyway, he talks about what he calls the big 3 about facial beauty. And cheeks are number one. And people think it's eyes, but it's actually the way the cheeks kind of like sit that actually help frame the eye. So that is number one. And then followed by a distant second would be, I believe it's eyebrows, eye area, and lips. So, but I mean, cheeks is like so far ahead of them. But on a scale from 1 to 100, like those big three things make up like 92% of facial beauty, according to his book. What's your number? Hold on, I'll show you the book. And I'm back. Alright, this is the book. So, get it. You know, if you're thinking about having plastic surgery, it's a pretty good guide. But do your homework, and that's why I'm doing this. I did a lot of homework, and you know, I feel like other people should benefit. I also went to another doctor. His name is Dr. Risk. That was my first doctor I went to. He's amazing too. I just decided not to go with him for the one reason is that he doesn't really do financing, but he's awesome. I saw a celebrity in the waiting room. Ow, I'm peeling off my band-aid. Ow. In the waiting room when I went. I'm not going to name names because, you know, he probably doesn't want to know that he was there, but I honestly don't even know what he had. I just know that he was there. So he's awesome. So check him out too. He's really, really good. But you gotta have the money up front. I had most of it, but I still needed to take out some. Yeah, so that's it. That's I'll get back to you guys tomorrow. Sorry, I keep looking over here because that's where the video, my pictures. Alright, cool. Day one. Success.